to us as well. So again, thank you very much for your time. Again, Medicare, understanding and navigating the planning process. Again, my name is Steve Puckett. I'm managing partner of Fiduciary Pension Partners. Fiduciary Pension Partners is an independent consulting firm that is employee owned. Again, we work with employers and employees on providing the best benefits for those employees, whether it's qualified plans, non-qualified plans, again, financial wellness programs. We want to make sure that we can make everyone have a successful financial journey into retirement. We do work with plan design. We work with institutions and fiduciary governance and employee education. Today, I'd like to welcome Andy Larson. Andy Larson is with the Retirement Learning Center. Again, he has over 35 years experience in the financial services industry, a frequent lecturer, frequent speaker on many topics like Medicare and Medicaid. And also I want to give a clap out to John Kersey. John has been very instrumental with Voya in helping us secure Andy Larson and the Retirement Learning Center. So thank you very much for Voya. And with that, I will turn it over to Andy. And again, Andy, let's start with the overview and origins of Medicare. And we can keep this very open. And again, I'll try to add my feedback, kind of what we see working with over 35,000 participants nationwide. I'll kind of add what we're seeing from Main Street, and you can tell us what you can see from DC and from the halls of the Senate and the House of Representatives.
Thank you, Steve. I appreciate the chance to chat with everybody about Medicare. Now, before we continue, I just want to manage expectations. What I'd like this to be is a discussion. What I'd rather not do is read you slides, because what I've discovered over the last 30 plus years is when I read people's slides, a lot of people don't stay awake. So we're going to have a general discussion about Medicare. Steve and I will kind of go back and forth on some of the key points. But then we'll go through some of the slides highlighting some of the key stuff. And if you've got comments, please, send them in. We're happy to go back and cover things in more detail if you wish. But we're just going to stay on this slide for a while. And first of all, the origins of Medicare. This is part of President Lyndon Johnson's Great Society initiative during the 1960s. Currently today, it's the second largest federal program, second only to Social Security. Medicare is eligible. Your people that are eligible for Medicare are once they turn 65. There's no age 62. There's no 70. Age 65. That's when an individual can become eligible for Medicare. Now, if you're still working at 65 and you're under your employer's group health plan, you may not want to sign up for Medicare at 65. So maybe you decide to retire at 68. Once you retire past age 65, you have a period, and there's some variation in this, but generally you have a number of months to sign up for Medicare during what's known as a special enrollment period. And we'll talk about this in a few minutes. Conversely, if you are retiring at 65, if you're claiming Medicare at 65, you've got what's called your initial enrollment period. And that is a 7-month period that begins the middle month. Month 4 of the 7 is the month you turn 65, the 3 months before and the 3 months after. So most people sign up for Medicare at 65. They've got that initial 7-month period. Next, the costs. Medicare is not free. Medicare, you pay 2 types of premiums for the Medicare program itself. The first part is what's called your Part B premium, and the second part is your Part D premium. That's the drug coverage. Your Medicare Part B premium is variable based on your income. And the premium is I'm just going to give you round numbers. The premium is anywhere from around $160 a month per person to about $750 a month per person based on your income. So Medicare is not free. So as an example, if you had a married couple, both 65, high income, just the Part B premium could be $1,500 a month. So Medicare is not free. In addition to the Part B premium, there's also a drug premium that's less than the Part B premium. And we'll see a slide on that in a little bit. But the more important, there's two key decisions you make with Medicare. Number one, when are you going to sign up? And for most people, that's 65. The second key decision, and I would argue this is probably your most important decision, is are you going to get a Medicare supplement? And then what type of supplement? Medicare doesn't cover everything. The vast majority of Medicare recipients sign up for a supplement. There's two kinds of supplements. The first is called Medigap. This is an older program, been around for a long time. The second choice is something called Medicare Advantage, or MA plans. These have become much more popular, primarily, I think, because there's a lot more money involved in the marketing of these. So the first choice is, do I want a Medigap or do I want a Medicare Advantage? And the answer is, it depends. Let me give you a very high level rule of thumb. There are plenty of exceptions to this. Medigap plans are generally better for people with existing health issues. I say that because Medigap plans have typically higher premiums, but greatly reduced or non-existent deductibles and copays. So the higher premium may end up being cheaper for you if you've got pre-existing conditions. Medicare Advantage, the premiums are often significantly lower. However, much higher deductible and copay. Now, how do you know which one to pick? How do you know which one is available? And this is something, if you're taking notes, I want you to write the word available with a question mark after it and circle that. Because the Medicare Advantage and the Medigap plans available to you are based on where you live. For example, I live in northern Minnesota. The plans available to me are different than if I lived in Minneapolis, 3 hours to the south. So, well, how in the world do you know potentially which plans are available? I'm going to give you a shortcut. The Medicare website, Medicare.gov, has got an outstanding tool to help you find which plans are available based on where you live. You go in, you list your zip code, bang, the available plans pop up. Not only the plans pop up, the details of the plans in summary pop up, and you can also do a comparison right on that website. So step one of your Medicare planning is spending time on Medicare.gov looking at what is available. Steve, thoughts on that or the topics we've covered so far?
Yeah, so I think the number one question I always get when it comes to Medicare is, when can I take it and when do I have to take it? So I think you outlined those differences. Obviously, a lot of it has to do with if you're still employed and still working, then you don't have to take Medicare. But that's the number one question I get. And again, we will go through, the 4 parts of Medicare, and Andy alluded to them. We always get those questions about Part B, Part C, Part D. We'll cover that as well. That's the second most popular question. But another less popular question, but very interesting question is, I know these are based by where I live. What happens if I turn 67 or 68 and I move? Do I need to look at maybe changing my Medicare Advantage plan?
Excellent question. Once you're on Medicare, once you've selected a Medigap policy or a Medicare Advantage, and you move, it could be an issue. And here's why. And this applies primarily to Medicare Advantage plans. Medicare Advantage plans work more like the old group health or PPO, HMO type things. You've got to stay in coverage. So let's say that you are in coverage in Tampa, Florida, and now you're going to move to Western Montana and live in Billings. If that is out of coverage, you have a problem. The good news is there are special rules that if you have certain events, like you've moved or the insurance carrier that you were using was taken over by the state, something like that, you can switch up plans within a prescribed time period. So if you are going to be moving once you're on Medicare, make darn sure that where you're moving to, you've got some options. And frankly, I've worked with couples and individuals all over the country. And I've seen situations where couples have frankly had to make decisions about changing where they were moving to based on the availability or the lack of availability of certain types of policies. So this is very much dictated by your geography. Now, that said, the big Medicare Advantage providers are pretty good at knowing where their customers are. For example, many of us in Minnesota head down to Arizona in the winter. So the big clinics, the big hospitals here in Minnesota have branches, have facilities in Phoenix and Tucson, etc., because there's enough of a constituency, they want to keep those people in coverage. But it's an important thing if you're thinking about moving once you're on Medicare. Thoughts on that, Steve?
No, I think that's a great idea. And, obviously, as you're approaching a retirement, there's a lot of things you need to do. Budgeting obviously is one, pre-retirement, post-retirement expenses is another. And again, if there is a chance of you moving, that's something you should think about. If, I know a lot of people in the Metro New York City area, are looking to, looking in Arizona, looking in New Mexico, Texas, Florida, make sure you understand, those implications as well. Just another planning task to work on.
Yeah. One of the questions, Steve, that I get is from couples or individuals, when should I start Medicare planning? And my answer is I would start it by 60. Because, you're not eligible till 65, but, it does take some time. I think it's important for you to start planning before it becomes critical. What I find a problem is when someone is within weeks or even days of the end of an enrollment period and they haven't decided yet. When you're in a hurry, you don't make good decisions. So as a birthday present to yourself, starting at 60, I would just pretend you're going to be eligible and go to Medicare.gov and start looking at those policies, start looking at premiums. And then, Medicare planning, if I had to describe it in a phrase, it's don't try this at home. Medicare planning, you want to, for example, involve your CPA, because that's going to be affecting your income, your cash flow based on the premiums. You want to be talking to your investment advisor, because those premiums are going to impact your retirement income strategy. You'll want to be talking potentially with a realtor. If, for example, where you're living, you don't like the policies, you may have to end up doing some shopping for a new domicile to get a better policy. Now, that doesn't happen in a lot of cases, but I would say at least in 10%, maybe 15%, there are coverage issues where couples have to make domicile decisions.
Yeah, I think, the three planning that we recommend between ages 50 and 60, again, building a budget, understanding your pre-retirement expenses, your post-retirement expenses, Social Security planning, how much are you going to receive? When are you going to take it? And then Medicare. Those are the three big life events that you need to start planning between ages 50 and 60.
Excellent recommendation. Well, let's click through a few of the slides and maybe get into a little more detail. As I mentioned, Medicare is the second biggest federal program, consumes about 17% of GDP. So it's a big program. Next slide, please. Origins, that's back from the Great Society from President Johnson. Next slide, please. It's funded through payroll taxes. Medicare funding is 1.45% on the employer and on the employee. And then with households with higher incomes, there's an additional 3.8% Medicare tax on investment income. So there's a lot of money going in, and it's an expensive program. Age 65, you can delay it if you're still under a group health plan. Next slide, please. Medicare is based on some trust funds. Yes, there's some financing problems, and somewhere late in the next decade, you'll probably see some significant changing in the financing of Medicare, most likely raising of the Medicare tax. Next slide, please. Medicare Part B used to be called the hospital part. It's a lot broader than that. Part C is the Medicare Advantage program I talked about earlier. Part D is the drug program. Don't get too concerned about A, B, C, D. You don't have to know that to make good Medicare discussions. This is just administrative stuff, what goes on under the hood in terms of administration and funding. Next slide, please. Coverage available at 65. Next slide, please. The Medicare Part A is usually free for most individuals. Next slide, please. Part B is the physician and the medical supplies, a listing of some of the stuff that's covered. Next slide, please. Part D is the drug plans. And a lot of times the drug plans are baked into your Medicare Advantage. The good news is the dreaded donut hole has been eliminated, so it's not quite as costly for people with high drug costs as it used to be. Next slide.
And there is talk about, Biden did have a supplement in the prescription drug services to help stabilize costs. There has been a discussion about removing that subsidy. Estimates could increase the prescription drug costs for approximately $5 to $10 per month per person, depending upon their drugs. But again, there always and there will continuously be changes to Medicare. Obviously, Part D has been one where we've gone through 15 years of very wild drug prices. Again, even if it's, just some basic drugs, I've seen them skyrocket from $10 a prescription to $100 per prescription. The EpiPen that originally was $6 for a dose spiked up to $800 per dose. So I think this is always going to change, but just be, ready. This is something that, you do have to look at, and especially if you are in a specialty situation, you may want to just look at, the coverage of that specialty drug as well.
That's a good point to bring up, Steve. And just to give people a hint as to how to approach that, let's say you're on a drug that the price just went nuts. The Medicare.gov site is a very good tool to use to find alternatives or less costly drugs or their formularies. It's a really good consumer-friendly site to help individuals in those circumstances. Next slide. Okay, next slide. Part A, no premium. Deductibles about $1,700. It covers your hospital stay for up to 91 days. After 91 days, then there's no coverage. Skilled nursing facility, and folks, this is something that there's a lot of misunderstanding. Medicare doesn't cover skilled nursing facility beyond 100 days. Beyond 100, it's all out of pocket. So beware, and that's why we have Medicare Advantage, Medigap, long-term care to fill these gaps when life gets messy. The Part B premium is about $200 a month. There's a 20% copay with most Part B services. Next slide, please. And here's the means adjusted premiums based on your income. Your Part B premium could go up significantly. Next slide, please.
Yeah, and one point that we are seeing, not only with Medicare, but, other services, this income, threshold or income base at retirement, it's leading a lot more individuals to maybe think about using the Roth. The Roth is pay the tax now, and then at retirement, I don't pay taxes, and it's not, income. So, that's what we're starting to see as well, is a lot of these income-based, insurance, Medicare, Medicaid, and IRMA is leading toward, it might make sense to use some Roth monies in your 401k as well to keep your income at retirement much lower.
Really good point, Steve, because again, Roth disbursements are not taxable. They don't count against your income. And here's the premiums for the Part D prescription drugs. Again, it's mean tested. And Steve said, Roth could be a way to mitigate this. Part D, the drug costs, annual deductible is about $600, 25% copay until you hit an out-of-pocket maximum, and then it's complete coverage. One interesting thing about those premiums that go up is those premiums are based on what your income was 2 years ago. As an example, I'm on Medicare, so my Medicare premium for 26 was based on my 24 income. Interestingly, last year, 2025, my income was based on my 2023 income. However, in 23, I sold a business. So I had a one-time big spike in my income. If you have a one-time or infrequent big spike in your income 2 years prior, you can request that Medicare use a different year to figure your premium. So if you get a big stock grant that matures, you sell a business, you have a big income situation that ramps up your Medicare premiums, you can request an alternate year be used as Form SSA number 44. So the Medicare premiums are based on your income 2 years previous. You have some flexibility to request an alternate year.
Yeah, and we see that on the Northeast, where many firefighters, police officers, where they max out their overtime in those year or two before their retirement. So they want to basically work, multiple shifts, multiple hours to get the maximum income. Because when they do calculate that final year or the final 5 years for the pension, you get that benefit. So, but again, use alternative years if that is the case for you.
Next slide, please. Again, virtually all individuals elect alternative coverages. Start looking early. Medicare.gov is the place to go to start your search. Next slide, please. Again, I'm giving you the high level of the two different programs, so we'll go to the next slide.
Yeah, and like what Andy mentioned before, Medigap tends to be higher premiums, but covers more issues, more concerns if you are, in, what we would call less ideal health condition. Medicare is, more of the lower cost, lower premium. But again, make sure you understand and look at both of those coverages.
Big question, which one should I get? Well, the first part of the question is what's available to you. In some locales, there may not be much available, but again, that Medicare.gov comparison site is your first stop.
Right.
As I mentioned, the Medicare Advantage is more like a HMO, PPO, where you've got to stay in coverage. So if you're somebody that RVs for a living and you're in lots of different states, you might want to look at a Medigap. Would probably make some sense. Next slide, please. Again, there's the differences that Steve just mentioned. Next slide, please. Not available to all everywhere. And that's my big takeaway is you may have a brother-in-law who loves his Medigap plan or Medicare Advantage plan. Oh, you should get it. It might not be available where you live. Hopefully it is.
And like Andy mentioned, the magic is that Medicare.gov website. So again, make sure you look at that before you turn 65 or 64. It's probably someplace, like Andy mentioned, you want to plan years in advance. And again, make sure you put in your zip code, or potentially zip codes that you may move to. Hey, my sister just moved to Scottsdale. Maybe I should put in Scottsdale or Palm Springs or Santa Fe, New Mexico. It doesn't hurt to plan in advance.
Again, planning and coordinating, getting started early. I recommend 60. Some people wait till 62. Don't try this at home. Get your advisor involved, your CPA, your broker. Ask questions and ask a lot of questions early. Next slide, please.
Yeah, and again, the other question I get a lot is it's so confusing. It's so hard to make, understand this. Again, as you research, you're going to pick it up. You're going to, the more you understand, this is not something that people talk about in their 20s or 30s. You're certainly not teach this in college or high school, or even, when you turn 30, all of a sudden you get a Medicare lesson. So again, learn. If again, after you do research, there are professional people out there that can help and help work with you to find the best policies. But again, start at age 60 and start doing some research.
Medicare.gov, that's your best friend. And next slide, I think. And next slide. And next slide, I think we're about.
Yep. So the only thing that I want here is, some people confuse Medicare with Social Security. And in Social Security, you'll have an FRA, a full retirement age. And based on your date of birth, that could be 66 and 6 months. That could be 66 and 10 months. That could be 67. And realistically, with Social Security, you can take it early and you can take it later, typically to a maximum of 70 years of age. That is not the case with Medicare. Like Andy mentioned, 65 is that magic number. There is no, hey, I want to wait until 70. If you're still employed, that could be the case. But if you're not, Medicare doesn't have that. I want to take it sooner or I want to take it later. It is very strict in terms of when. And in fact, there could be higher premiums that you have to pay if you make that mistake. Andy mentioned the 6 months in advance, 6 months after. You miss that, you could start paying higher premiums. So don't think of this like Social Security. They're two absolute different vehicles. Medicare is age 65, absolutely, unless, of course, you're still employed and still working. Social Security, you do have more flexibility. Medicare, you do not.
Good point, Steve. As I mentioned, there's the enrollment periods listed here, the penalty for missing the enrollment periods, and they're a little different based on which program we're talking about. Again, planning and coordinating. One last point I'll make is if you're participating in an HSA, you should stop contributing to your HSA up to 6 months prior to your Medicare eligibility. Because if your Medicare eligibility ends up being backdated, you could end up with an HSA excess contributions that have to be corrected. So if you're in an HSA, shut them down, shut your contributions into it down 6 months before your potential date for Medicare.
Yeah. And so again, HSA, age 64 and a half, again, put that on the calendar, put that on a tickler to make sure that you deal with that program.
Next slide, please. Oh, foreign travel. Medicare generally doesn't cover you on foreign travel. So what do you do if you want to travel overseas and you're on Medicare? Get a special policy that covers you for that trip. There are a lot of carriers provide those policies, but don't depend on Medicare. If you're going to, go to China or Vietnam or, wherever. There's a few exceptions as noted here.
Yeah. And again, U.S. territories are typically covered, outside, even though they might be U.S. friendly, like the British Virgin Islands, they are not covered. Oh, and that's exactly what Andy mentioned. If you are contemplating travel, again, travel insurance is optimal to look at that coverage.
Again, plan. Don't try this at home. Work it into your budget. Talk to your advisor. Talk to your insurance folks.
Yeah. And again, that's the big one is if you do move, that's when you may have to change plans. Like Andy mentioned, many of the Medicare Advantage plans are regional in nature. So just make sure wherever you're moving to, you will have coverage as well.
And the enrollment periods, once you're in Medicare, you could switch your Medicare Advantage. If you want another plan, you can switch between October 15th and December 7th. The other open enrollment periods from January to March. But again, these are all things that are on that Medicare.gov site, and the government will send you more information than you will ever need to keep you alerted to, oh, you've got this enrollment date coming up. You will get plenty of new mail. Once you're on Medicare, you'll get plenty of information. So if you miss the deadlines, it's because you're not reading your mail.
And I will caveat that as well. You will get solicited by so many Medicare Advantage plans. You will be shocked at how big this business is. This is a very big insurance business. So don't be shocked if you're exceeding the mailbox, and all of them are third-party Medicare Advantage plans.
Once you get in a plan, for example, your Medigap policy gives you a free look for 30 days. If you decide you don't want it, you can switch to something else. Beyond that, you don't have as much capability to switch Medigap. Medigap is kind of a one-way door. You can get in, and if you come back out, you can't get back into a Medigap plan under most circumstances. That's not the case with Medicare Advantage. Medicare Advantage is more flexible in terms of changing plans.
Great. Well, Andy, thank you very much for this presentation. Again, like I mentioned, Medicare is a topic that we get so many questions on, and every time we do a presentation, even our most senior CFO, financial CEOs, they all say, I learned something new today. So again, it is a very difficult subject. It is very complex, but I think, kind of the takeaways that I have, and Andy, I'll let you put away your takeaways are, again, go to the Medicare.gov website. That's very important. Learn. Don't wait until age 65. At age 50, 55, those three big important things that you need to do. Budget. How much am I spending pre-retirement, post-retirement? Build a budget. Number two, Social Security. How much am I scheduled to have and when? And then Medicare. Those are the three big things at age 50, 55 that you need to start looking at. And then again, I think, like Andy mentioned, location, put in your zip code of where you live, where you may live, where you're thinking about living, and just having a plan. So that's my takeaways. Andy, if you want to offer your takeaways, and then Cynthia, we can wrap it up.
Actually, there's some questions as well. So I'll let me know when you're ready.
Just one point I'd like to reinforce that Steve made earlier is Medicare decisions are different than Social Security. Don't get mixed up between when you sign up for one or the other, because I've seen couples do that and really have a bad situation. Medicare, 65, period. Social Security, you can sign up between 62 and 70. They are different. Thank you.
Thank you. Thank you for your time. Again, we're going to stop recording and we will open it up for questions.